Coming around towards 6:52 in Trinidad and Tobago. Good to have you with us as we continue in the first hour, coming to the end of the first hour of Morning Edition on this Wednesday. Well, indeed, coping with the global pandemic relies on a collaborative effort. And we're joined now via Zoom by Dr. Soomer, based here in Port of Spain. She's the Association of Caribbean States Secretary General. She's serving a 4-year term, I think in the final year of that 4-year term. They've been coordinating the response teams to deal with the impact of COVID-19 in our region. At a meeting with Foreign Affairs and Health Ministers, Dr. Soomer said that information sharing must be the first step. We've heard how different regions are doing different things and how they are doing similar things. Best practices must be shared. Well, we have with us a very good morning to you, Dr. Soomer. Thanks very much for joining us this morning. Give me your sense from the ACS perspective. How are we coping in our region with COVID-19?
Well, good morning. Thank you very much. We are coping very well. That's my perspective. In our various regions, remember that the ACS covers all of the regions that are around the Caribbean Sea. So we cover, first of all, the CARICOM group. We cover the Central American group. We cover the group called the Big Three, which is Mexico, Colombia, and Venezuela. And we have a group also called the non-group, which consists of Panama, Dominican Republic, and Cuba. And we are working together at the level of the ACS and the level of the Greater Caribbean to ensure that all of the functional cooperation that we have been practicing for since the establishment of the ACS in 1994 is coming to fruition.
Would it be correct, Dr. Soomer, to say that this is the greatest challenge faced by the ACS, or certainly in your tenure as Secretary General?
Well, yes, I would say that, because it takes a lot of coordination and cooperation for us to be able to do the things together. And we are putting things in place to ensure that we have a regional cooperation coordination strategy. Because this is going to be with us for a little while. It's new now, but it's going to be with us for a little while. So we are doing things at different levels to ensure that we have less loss of life, as well as we recover from this COVID-19.
And when you have a situation, Dr. Soomer, where you're talking about such a diverse region under the umbrella of the ACS, and you mentioned some of those nations, different ways of doing things, different cultures, different standards, health standards and otherwise, small territories, large countries, and so on. It must, I wouldn't say a nightmare, obviously, because clearly from the ACS point of view, you want to believe that the collaboration, the cooperation is working. But in times of a stress created by a COVID-19, which is really a life or death situation, is the network working effectively? Do you have some who are lagging behind, some who are way ahead of the situation? Does that present the challenge?
No, we are not stressing. We are working. We have been doing this cooperation for, as I said, more than 25 years. And we have the experience of disaster risk reduction in the Caribbean and across the Greater Caribbean. And so we are using the same kinds of mechanisms. And I don't think that any of our countries are lagging behind. You can see, because you might be more familiar with the CARICOM group, what a coordinated approach is being taken. What we at the ACS is doing is to ensure that the best practices that we see across the Caribbean are shared. And we are also trying to identify the gaps, because of course, not everything will be perfect, and some people might fall through the cracks. So we are also looking at these people. We also have very vulnerable groups in the region. But we are used to dealing with that kind of diversity, big countries, small countries, different languages, different economic levels of economic development. And so it is a good opportunity for us to see how South-South cooperation is really working and what we can do to improve it. I also see opportunities in this period of the pandemic for us to even get closer. And you can see it in the outreach of the membership to each other. Let's take Cuba, for example. Cuba is in 11 of the 14 CARICOM member states assisting. And not just the member states, but they are moving also into the associate member states. So we expect them to be working very soon for example, in Martinique, in Montserrat, in the British Virgin Islands. So you can see the spread across the Caribbean. The Central American group, SECA, is extremely well organized. And so they are also sharing the experiences of the ACS. They want to share some of the things they have also put in place, like joint procurement of medical and pharmaceutical products, as well as some of the funding experiences they have put together, so that we can see how things work across the Greater Caribbean. We are getting that assistance from around the Greater Caribbean. And so we are trying to ensure that there is not one country left behind in the Greater Caribbean.
And before we toss to a break, we're going to go to the news for a little while and then come back with the discussion, Dr. Soomer. But just very quickly, as a native of St. Lucia, your hometown, Castries, the capital, you clearly identify with the vulnerabilities of small Caribbean states, more looking long term, because as you said, this is going to be with us for a while. How do you see things rolling forward?
Well, it will take all of our efforts. We must all come together for us to be able to survive this and to emerge as greater countries, because people are already predicting that we will be falling back to the mid-90s level of development. And we cannot afford for that to happen. So we have to find ways of ensuring that we minimize the impact of COVID-19 on the social and economic fabrics of our countries.
Dr. Soomer, we will pause for a moment. In fact, we'll talk when we come back after the news about the formation of the regional multi-sectoral technical task force to tackle COVID-19. That was announced on Monday by the ACS. We'll talk a bit about that, and some other points we'll develop with Dr. Soomer as we try to get the sense of the regional response to COVID-19. And indeed, it is something that will definitely be with us for quite some time, and it's about coping and strategizing and implementing all of those strategies to ensure that no one is left behind in our region. We go to the news at the top of the hour, and then we'll return to our dialogue. Coming up towards 2 minutes after 7 o'clock in Trinidad and Tobago, as we return to our dialogue with the Secretary General of the Association of Caribbean States, Dr. June Soomer, based here in Port of Spain. I was reading an interview with Dr. Soomer on the Newsday, I think it was November of last year, where she was explaining that because as a woman, she often gets that kind of response when she was coming in through customs, through immigration at Piarco some time ago, that the immigration officer said, you don't often see women in such important positions as that. No doubt he got a diplomatic buff for that sort of comment, Dr. Soomer. But has that been a challenge in any way? Being a woman from a small Caribbean territory, being of African descent, being a black woman and so on. And people have these preconceived notions that take us back to the colonial era about women not being in such significant positions. Do you have to cope with that still?
I'm not saying that I don't have to cope with it, but it is not presenting a challenge at all. You can see women rising through the Caribbean, and these days we have a very good example in the Prime Minister of Barbados and her impact, not just regionally, but internationally. So I think that we are making our way. It has been a little difficult for us. And in these days of COVID, we are seeing women's roles again being re-examined. Women right now are being impacted greatly by COVID-19, not just women of African descent. All women are being impacted by COVID-19, and it's one of the things that we have to put on the table, because regionally and globally, you see a rise in domestic violence. You see women having to undertake more unpaid work. And so it's one of the things that we have to consider as we move forward, that women do not lose the strides that they have made before COVID, because we are finding ourselves and our roles again being re-examined within the social context that we live.
Indeed, that is a topic that certainly needs greater elaboration. But just as we're talking about the different roles of the different organizations that have been activated to cope with COVID-19, just earlier this week, the announcement of the regional multi-sectoral technical task force, and I know there have been other collaborations and coordinations over the past 2 months. So the ACS has certainly been working on this. Tell us about the implementation. What are you hoping that this task force will be able to achieve?
Well, we hope that this multi-sectoral task force will be able to help us to put in place an action plan for us to recover. Right now, I think the issue is about resilience and recovery. So we have been building resilience in the first part of the work that we have done. We have met, remember that the ACS gets two, as a multilateral organization, we get two bites at regional integration, one with the member states and one with the regional bodies. So since January, we have been convening meetings, even before COVID became an issue. We have been convening meetings of the regional bodies, CARICOM, SECA, ECLAC, CTO, CACA, SECA, all of the regional bodies have been coming together for us to coordinate the work that we are doing and also for us to tackle COVID-19. So we do not have duplication of effort in any of our areas, and we ensure that we set the priorities. So now that we have met and set priorities, we have had two meetings since the meeting that we had with the Ministers of Foreign Affairs and Health. We have had two meetings to ensure that we develop a regional cooperation and coordination COVID-19 strategy. And that has been sent to the ministers for review. But more than that, we have been working together as a region, both at the level of membership and at the level of the regional organizations, to ensure that we put the information out to the general public. These are the people who are affected. And so one of the things that we have done at the ACS is to create a COVID-19 dashboard, where that technical group will also be able to go and input all of the best practices, all of the things that they're doing in their countries, so that you will be able to see, and we'll be releasing that dashboard to the membership and to the public from tomorrow. You will be able to go and click and see what is happening in each territory and be able to make an assessment of the Greater Caribbean. There is no other tool right now in existence that covers just the Greater Caribbean. You might get one for Central America from CEPREDINAC, you'll get one from CARICOM that CAPA is managing, but you do not get something that integrates all of the information across the Caribbean. And so that is what our COVID-19 tool is doing. This resilience tool will be used afterwards to be able to monitor different situations in the region, whether it is with regard to education, whether it is with regard to disasters, etc. So we are putting these things in place to ensure that the technical group will have good information to be able to make decisions in different areas. We expect that we will have a multi-sectoral group across the region, for example, on sustainable tourism. We have been working with CTO, we are working with the Central American, we are working with our different memberships for us to look at how we recover tourism after. And we are already starting to put things in place for recovery. We are looking at the same thing with regard to trade and food security, for example. We are having conversations right now with Central America about food security, and we have met with a number of the shipping agencies with regard to shipment of food, the trade that is going to happen, because you have to realize that value chains and will change. We are not going to get food from our traditional sources. So we are trying to put all of these things in place to ensure that the task force will be able to help the governments to bounce back quickly, and not just bounce back, but to scale up immediately after COVID, and even during COVID, for us to put these things in place to assure our membership, and particularly our citizens, that things will soon be all right.
It must be especially difficult, though, when you're dealing with such an open-ended issue, because we don't know when this thing is going to come to an end, in the sense that when is there going to be a vaccine that is globally available, when is it going to be rendered to a level where it is manageable and will allow a certain level of normalcy, or if indeed, how do we cope with each other? Are they going to make it much more difficult to retain the gains that have been made economically, socially, and otherwise, when you don't know when this thing is going to come to an end? How much of a task is that?
Well, Mr. Mohammed, we don't know when anything is going to come to an end. We have had a lot of difficulty in the region. We are used to dealing with difficulties because we are a very vulnerable region. We are one of the most vulnerable regions in the world. We are one of the most, we were the second most unequal regions in the world. So it's telling us that we cannot continue as we have been doing. So I think that this pandemic is giving us an opportunity to look at some of the things that we have not done in the past to ensure more equity in our societies so that people have access even in times of crisis. So if we do not look at our vulnerabilities now, and I remember looking at the interview with the Prime Minister of Barbados. Incidentally, I'm saying Barbados more because Barbados is also the chair of ACS, as well as the chair of CARICOM. And so we have that kind of coordination, and it's better coordination right now. And it comes at a very critical time. So I am saying that we have never known how things would go in the future. We don't know when the hurricane is going to impact us. What we can do is prepare. And that is what we are trying to help the countries to do, and also to make the changes. Look at South-South cooperation, and we have been talking about it for a long time. Let us make it a reality for us to be able to see the benefits we can gain from looking at our partners and our friends. In many cases, they are friends across the region. We have not had a challenge at the ACS with regard to the cultural differences, even with the ideological and social differences, because of the fact that we coordinate and cooperate across the Greater Caribbean. And in many cases, although, yes, there's a political undertone, but it has not affected how we cooperate across the Greater Caribbean. And I'm saying it's not going to be easy. It has never been easy, even in the best of times. I'm saying that we have an opportunity to improve it and to make it better.
Dr. Soomer, thank you very much for taking the time to be with us this morning. Dr. June Soomer, the Secretary General of the ACS, a student of history, a history lecturer, history professor, did a PhD focusing on history as well, and therefore would have that context to where we are as a region and dealing with the many different challenges that we've had to face, but certainly COVID-19 presenting one that probably we've never had to cope with for a very long time, certainly not since the impact of the world wars, the last World War ending in 1945. Well, as we go to the break, here's another